Good evening. This is Micah Brown's case management plan for the youth of the infamous Slenderman stabbing in Chernoff's juvenile delinquency. When it comes to youth involved, there were the two offenders, Morgan Geyser and Anissa Ware, and the victim, Peyton Lutner, who were all 12-year-olds. The two offenders planned to stab their friend during a sleepover, eventually deciding not to and stabbing Lutner later 19 times on Saturday, May 31st, 2014. And although there were no direct witnesses, the girl survived thanks to a cyclist finding her. The stabbing was reported as occurring in the wooded area of Davids Park in Waukesha, Wisconsin, during a game of hide-and-seek, and they were reported to have committed the stabbing as a way to protect their families and live with Slenderman in his mansion, as well as a result of later diagnosed mental illness. Taking everything into account, then, this means that some of the most important factors for Geyser and Ware were their ideation to protect their family, their underdeveloped minds, the stabbing location, their lack of socialization with others, the peer collaboration, their internet addictions, and their mental illnesses. A lot of the factors involved in this case can be explained through three distinct chronological perspectives. The psychological perspective, for one, views delinquency as a result of mental and unconscious processes that are developed early in life. In theory, this means there have been attempts to explain delinquency through psychodynamic theory, behavioral theory, and information processing scripts theory. The latter of which would say that Geyser and Ware responded to their situation inappropriately because environmental factors like obsessive internet consumption due to addiction and a lack of proper socialization have disrupted their interpretations. These, in combination with internal factors like mental illness caused cognitive deficits, impaired their ability to understand the severity of their pre-existing scripts. A good prevention that would fall under this perspective would be the Incredible Years Child Training Program. It seeks to use handouts, roleplay, and videos to introduce activities that encourage cooperating with adults, using proper coping mechanisms, and solving difficult social problems. This would be a good prevention for youth like Geyser and Ware due to the link to mental illness issues like conduct and oppositional defiant disorder, and the need that children going through these problems and lack of socialization have for better problem-solving skills and emotional control. However, this prevention would not work for those in the adolescent age group like Geyser and Ware, since this is meant for 4 to 8-year-olds. A good treatment that would fall under this perspective would be youth advocate programs, or YAP. This treatment pairs mentors up with the youth offenders as mentees that aims to become a relationship of trust that strengthens the family and community relations and deterring kids from engaging in future delinquency. This treatment would be especially good for Geyser and Ware because it would give them a role model, and that could help them build their social skills and end their lack of proper socialization and internet dependency due to the activities their advocates will assign. Though it would not be particularly good for Geyser and Ware in a sense because they were already performing well in school and thus wouldn't exactly benefit from the increase in educational engagement. The social controls perspective, then, would view people as inherently deviant because of crime and delinquency's assumed natural quality, and that those youths who lack proper socialization and social controls will be especially likely to engage in delinquent behavior. In theory, this can look like proposing containment, social bonds, and self-control, the latter of which would say Geyser and Ware committed the acts of delinquency because of their low self-control and subsequent impulsivity, insensitivity, and short-sightedness. The cause of the girls' low self-control can be seen as a result of their parents' lack of parental control implementation and establishing necessary punishments. A good prevention that would fall under this perspective would be promoting alternative thinking strategies or paths, which should work because of one of the components teaching kids the concept of self-control through age-organized activities like the turtle technique to get them away from the impulsive tendencies. This prevention would be a good fit for youth like Geyser and Ware because it benefits youth that have been exposed to violence, like violence as seen or described on the internet, due to a possible lack of parental controls over media consumption. Although it wouldn't be the best fit for youth like Geyser and Ware because of possibly not having prior anger issues when the program seeks to reduce pre-existing aggression. A good treatment that would fall under this perspective would be Project Build. As an example, it gives youth a better sense of self and helps them form inner containment by teaching them how to make better decisions, as well as how they and their actions are important through either school or correctional curriculum. Project Build would be a good fit for Geyser and Ware because it provides them outlets and constructive opportunities like participating in career training or after-school parties in place of spending time on the internet consuming content. However, this treatment may not be a good fit for the girls because it is meant to cater to youth involved in gang violence and substance abuse as opposed to mental illness. Finally, the biosocial perspective views people as having specific traits that increase their likelihood of engaging in crime and delinquency, and that there are physical, social, and environmental conditions that aggravate these traits. In practice, this has led to theoretical propositions like differential vulnerability model, biochemicals factors, and the risk-taking model. The latter of which would say that Geyser and Ware committed their delinquent acts because they were only 12-year-olds, not yet 16, not yet 25, when logic and executive function develop respectively. The socio-emotional concept of the theory is especially justified in the fact that the girls spent a lot of time together and with unrestricted internet, which allowed them to pressure each other into committing the stabbing to please each other and Slenderman. A good prevention that would fall under this perspective would be reducing lead exposure, since lead exposure can lead to serious mental and physical issues, meaning the removal of lead-based consumer goods and a reduction of lead exposure early on in life through things like the filtration of water should reduce the prevalence of these issues and reduce the likelihood of subsequent delinquent behaviors. This would be a great prevention for youth like Geyser and Ware because it seeks to keep youth at risk of mental illness from getting caught up in the juvenile justice system by reducing the likelihood of them developing mental health issues in the first place through the reduction of lead exposure. However, this wouldn't work for everyone, as there are other factors in life that can lead to mental illness or the commission of delinquent acts, like lacking socialization and being influenced by peers, respectively. A good treatment that would fall under the perspective would be aggression replacement training, or ART. ART's main goal is to reduce youth hostility and violence by giving them the opportunities to be less vulnerable to their own reactions by acquiring pro-social skills through structured learning training techniques like role-playing and through moral reasoning practices. This treatment would be a great fit for Geyser and Ware because of the structured learning training teaching them social skills through interaction and getting them off the internet and socializing them. However, this treatment may not be a good fit for Geyser and Ware because they have no pre-existing anger issues and would thus be receiving multiple parts of the treatment sort of in vain. And here are my sources. I hope you found this to be both thoughtful and actionable. Thank you.